In a world where diseases know no borders, how prepared are we? This question resonates more than ever in our increasingly globalized society. We're no longer isolated islands. Instead, we're interconnected parts of a larger, complex ecosystem. Our health, too, is not confined within our borders. It's a global issue. Consider the health challenges we face today. Diseases like Ebola and COVID-19 emerged from specific regions, yet they didn't stay there. They spread rapidly, crossing continents and oceans, infecting people in countries far removed from their origins. These are not isolated incidents, but a pattern that has repeated itself time and time again. In our interconnected world, a health crisis in one corner can quickly become a global emergency. The H1N1 influenza outbreak, the Zika virus epidemic, and the ongoing COVID-19 pandemic are stark reminders of our vulnerability. They underscore the fact that in the realm of public health, we're all in this together. But it's not just about diseases, it's about health systems. These systems, too, are interconnected, and a weak link anywhere can have repercussions everywhere. A shortage of healthcare workers in one country can lead to an influx of patients in neighboring nations. A breakdown in a country's vaccine distribution can result in a resurgence of diseases elsewhere. The bottom line, our health is a shared responsibility. We can't afford to ignore what's happening beyond our borders. We must be vigilant, proactive, and most importantly, cooperative. We need to foster a sense of global solidarity, where we don't just look out for our health, but for the health of our global neighbors as well. This is not just a noble ideal, but a practical necessity. It's about survival, about ensuring that our interconnected world remains a healthy one. So, how prepared are we? The answer to that question lies in our willingness to acknowledge our interconnectedness, to understand that what affects one of us can affect all of us. It lies in our ability to work together, to share knowledge, resources, and solutions. Our health is interconnected, and it's time that our solutions reflect this. Enter health diplomacy, a powerful tool in the face of global health challenges. In an ever-increasing globalized world, health issues are no longer confined to national borders. Illnesses and diseases can travel as fast as a plane, crossing continents and oceans, affecting people indiscriminately. This is where health diplomacy steps in. But what exactly is health diplomacy? It's the merging of public health and international relations. It's about creating a dialogue, a connection between nations to address global health issues. It's about using health as a bridge for peace, to foster relationships and trust, to improve global health outcomes. Picture this. We have two nations at odds with each other, but they share a common enemy, a deadly disease. Health diplomacy can foster cooperation between these two nations, allowing them to set aside their differences and work together to combat the disease. It's a win-win situation. The disease is controlled, and the relationship between the two nations improves. Health diplomacy is more than just about disease control, though. It's about advocating for health rights, ensuring that everyone, regardless of where they are born, has access to quality healthcare. It's about bringing to the table issues of health equity, ensuring that resources are allocated fairly so that the most vulnerable and marginalized groups are not left behind. In a world where health threats are becoming more complex and interconnected, health diplomacy is more important than ever. It can help bridge gaps between nations, break down barriers, and foster cooperation and trust. It can facilitate the sharing of knowledge, technologies, and resources, enabling us to respond more effectively to health crises. Health diplomacy doesn't just benefit the health sector. It also has spillover effects on other areas such as trade, security, and human rights. It can promote economic development, strengthen national security, and uphold human rights. In conclusion, health diplomacy is a powerful tool that can help us navigate the complex landscape of global health. It's about more than just health. It's about diplomacy, negotiation, and cooperation. It's about building bridges, not walls. Health diplomacy has the potential to transform global health if used effectively. Let's examine a real-life example, the fight against polio in Nigeria. Polio, once a global scourge, is now on the brink of eradication, thanks to the collective efforts of nations, NGOs, and local communities. And Nigeria's journey to becoming polio-free is a testament to the power of health diplomacy. In the early years of the 21st century, Nigeria was one of the few countries where polio remained endemic. The challenges were immense. Vaccination efforts were often hampered by conflict, accessibility issues, and misinformation, which led to vaccine resistance among certain communities. Enter health diplomacy. International organizations like the World Health Organization, UNICEF, and the Global Polio Eradication Initiative partnered with the Nigerian government, local health workers, and community leaders. They worked together to build trust, dispel myths, and ensure that every child could receive the polio vaccine. The United States, the United Kingdom, and other nations also played crucial roles, providing funding and technical support. They understood that eradicating polio in Nigeria was not just a local issue, but a global one. After all, in our interconnected world, a disease outbreak anywhere is a threat everywhere. But the true heroes of this story are the Nigerian health workers and volunteers. They navigated dangerous terrains, faced hostility, and even risked their lives to reach children in remote areas. Their dedication and courage, fueled by the support of the global community, paid off. In 2019, Nigeria marked 3 years without a wild polio case. The following year, the World Health Organization declared Africa polio-free. This milestone was a victory not just for Nigeria or Africa, but for the entire world. So, what can we learn from Nigeria's polio eradication journey? It underscores the importance of global collaboration in health. It shows that when we put aside our differences and work together, we can overcome even the most daunting health challenges. It reminds us that health is a shared responsibility, one that transcends borders and politics. This success story highlights the potential of health diplomacy in overcoming health challenges. Another compelling case is the global response to the HIV/AIDS epidemic. This health crisis, which has claimed millions of lives globally, served as a catalyst for a new era of international cooperation and health diplomacy. In the early days of the epidemic, the disease was shrouded in fear and misunderstanding. But as the severity of the situation became apparent, countries began to put aside their differences and work together to tackle this common enemy. This marked a significant shift in the way nations interacted on health-related issues, paving the way for health diplomacy to take center stage. One of the most significant outcomes of this global cooperation was the establishment of the Global Fund to fight AIDS, tuberculosis, and malaria. This initiative, born out of sheer necessity, saw countries pooling resources, sharing knowledge, and coordinating efforts to combat these deadly diseases. The Global Fund has since been instrumental in improving health outcomes worldwide. It has provided antiretroviral therapy to millions of people living with HIV/AIDS, treated countless individuals afflicted with tuberculosis, and distributed bed nets to protect against malaria in high-risk regions. Moreover, the Global Fund has not only tackled the diseases head-on, but also addressed the socioeconomic factors that exacerbate these health crises. By investing in health systems, promoting gender equality, and strengthening community responses, the Global Fund has made substantial strides in mitigating the impact of these diseases. This collective action has led to a significant reduction in the number of new HIV infections and AIDS-related deaths. It has also highlighted the potential of health diplomacy as a tool for fostering global solidarity, bridging political divides, and promoting shared responsibility for health. The success story of the Global Fund serves as a powerful testament to the power of health diplomacy. It underscores the potential of international cooperation in addressing global health crises and achieving health equity. The global response to HIV/AIDS underscores the power of health diplomacy in fostering international cooperation. It's a shining example of how, when we unite in the face of adversity, we can make significant strides towards a healthier, more equitable world. So, what does the future hold for health diplomacy? As we peer into the horizon, we see a world poised on the brink of monumental health challenges. The specter of climate change, looming large, presents a vista of health-related issues that transcend borders. Extreme weather events, shifting disease patterns, and food and water insecurity are but a few of the threats that humanity must confront. And then there's antimicrobial resistance. The very drugs that once heralded a medical revolution are now losing their efficacy. As bacteria evolve, our arsenal of antibiotics is becoming less effective. This global dilemma requires a united front, a worldwide response. In this future, health diplomacy has the potential to be our guiding light. It can marshal the world's nations in a coordinated, harmonious response to these health challenges. By fostering dialogues, building bridges, and facilitating collaborations, health diplomacy can enable us to face these issues head-on. But the success of health diplomacy in addressing these future challenges hinges on international collaboration. The world's nations must come together, share information transparently, invest in research, and devise collective strategies. The stakes are high, and the need for cooperation has never been more critical. Just as we've seen with the global response to polio eradication in Nigeria and HIV/AIDS, health diplomacy can catalyze transformative action. It can guide us in navigating the intricacies of global health governance, ensuring that health remains a priority on the global stage. Moreover, continued investment in global health is paramount. Funding research, bolstering health systems, and supporting programs that combat diseases are crucial. But the investment must extend beyond the monetary. We must also invest our time, our expertise, and our commitment to creating a healthier world. This is the future of health diplomacy, a world where nations unite to confront health challenges, where collaboration and investment drive global health advancements, and where health is a shared responsibility. By embracing health diplomacy, we can create a healthier, safer world for all.